Tuesday, the nonpartisan Congressional Budget Office said, yes, Obamacare, the Affordable Care Act, will, in fact, cost us 2 million full-time jobs in 2017. By 2024, that will extrapolate itself out to about 2.5 million jobs because people will hold employees back from reaching the threshold of full-time. The White House pushed back saying, well, these people now have the opportunity to work less and still get health care. Let's talk to an expert, former Wall Street Journal columnist and now chief economist at the Heritage Foundation. He joins us on our Turnkey.pro answer line. Stephen Moore is here. Hi, Stephen. Welcome back.
Hi, guys. Good morning.
Well, a lot of folks told us this was coming, and now that the CBO said so, this is going to be certainly something the Republicans can use politically between now and November.
Well, putting aside the politics, and by the way, this is something I've said on your show for the last 6 months, is that one of the effects of the Obamacare law will be to encourage employers to keep their employment down below 50 workers so you don't trigger the mandate under Obamacare, or to hire workers for less than 30 hours a week. These are the new, what we call 29ers. The 29ers are people who can only get a job 29 hours a week or less. And look, this is a big problem for American families because what it means is if you're a middle-class worker trying to support your family, you just can't do it on a 28-hour-a-week job. You just can't bring enough income in. So this is, I think, a bit of a crisis. And for the White House to simply cavalierly say, well, gee, they get their health care and they get to work less. Well, what about the income they need to literally put food on the table?
And isn't it true that if you make more money, though, you have to pay more for health care? So it keeps people down? I mean, if you're making minimum wage and you try to advance yourself, you're still going to have to pay more for health care under Obamacare. Right.
There are all sorts of, not just under Obamacare, but a lot of these government programs, the more income you make if you're a low-income worker, the more you actually lose benefits. So people with these kind of minimum wage jobs, they don't gain much income when their salary goes up. Look, I think this is a real crisis right now because if you look at the American economy, and again, I've talked about this with you guys in months past, one of the big ailments of our economy is that so many Americans are dropping out of the workforce. We have, the lowest percentage of working-age Americans working today in 35 years since, the time when women really started to enter the workforce in large numbers. That, as an economist, I see as a big problem. You can't grow the economy if you got 80 to 90 million people outside of the workforce, and Obamacare only encourages that trend.
The CBO estimated that 6 million people will sign up for this private coverage public MELD through this in 2014. That's down from the earlier forecast, but some of those numbers are in dispute, even the 3 million already enrolled.
Well, here's the problem. When you look at people who are, quote, enrolled under Obamacare, the vast majority of them have simply signed up for what we call Medicaid. You've got that in Illinois. We've got it in Virginia where I live. Well, Medicaid is really not a very good health care program. It's the program for the indigent. Everyone agrees that Medicaid, and not to be confused with Medicare. Medicare provides pretty high-quality service. Medicaid, a lot of hospitals and services and doctors don't even take Medicaid anymore because the reimbursement rates are so low. So what we're doing is we're pipelining millions of Americans into one of the worst healthcare systems in the United States. I don't see that as a big triumph.
I was plugging the Heritage Foundation yesterday with Amy here saying that I finally, and it's almost a dereliction of duty that I had not done this previously, got through essentially the Heritage Foundation's alternative to Obamacare, basically level this playing field for individuals that want to buy insurance so we can use pre-tax dollars for our health care. That would make it so much easier. Buy across state lines, and then just being able to buy across state lines with pre-tax dollars will give us enough people in these quote-unquote high-risk pools that it will be an attractive business model for insurance companies.
There's no doubt about that. And, here's the thing. I think virtually everyone agrees we want a healthcare system that provides health insurance for everyone, or virtually everyone in the country. We're a rich country. We can afford it. The problem is Obamacare does it in the worst possible way by stuffing people into Medicaid and so on, and by driving up the cost for everyone else. What you just described, which is the Heritage Plan, makes so much sense. For example, if you live in Illinois, you've got pretty high health insurance costs in Illinois. Why shouldn't someone in Illinois be able to shop around and find a policy in Utah or Michigan or Indiana that offers them the same coverage at a lower price? I mean, this is what we believe in as Americans, right? You get to shop around and find the lowest price. We do that for everything we buy under Obamacare, and I shouldn't say under Obamacare. These are pre-existing rules before Obamacare. You're not allowed to shop around in Illinois for a policy out of state that might provide better service at a lower cost.
Plus, my dollars are 35% less valuable because they're post-tax dollars.
Right, and that's the big deal, too, is, why not? Look, I just started the Heritage Foundation. They have a nice health care plan. I get to get that plan, essentially tax-free. That's the way the tax laws work. What we're saying is Heritage, well, what if I'm just self-employed? Why shouldn't I be able to, or what if I just want to buy health insurance on my own? Why shouldn't I be able to get the same kind of tax-free coverage that I can get through my employer? That would lower costs considerably. And I guess my point is, look, we can cover everyone in this country with far superior quality of care, because that's what we really care about, at a lower cost than Obamacare.
Is Obamacare going to be able to sustain itself?
Does it what?
Is it going to be able to sustain itself? Because you need younger people to enroll, and the younger people are covered by their parents, so why bother?
That is the great question. Of course, skeptics like me have been saying that it's going to go in what we call a death spiral. So what will happen is the costs will continue to rise, healthier people will continue to drop out, and that's why it's so important what you just mentioned, the young people. So far, we're seeing the people who are signing up for Obamacare tend to be older people and sicker people. Well, if you have a system, where you're insuring people with old people and sick people who use a heavy use of the healthcare system, that's going to drive up the cost of the premiums, and then more and more healthy people drop out, and that's what's going to happen with Obamacare, and we're already seeing signs of that. So the answer to your question is, it is not sustainable. I believe within the next couple of years, if it lasts that long, you're going to have mass departures from the Obamacare law, and we're going to then have to have major taxpayer subsidies to keep this thing alive. Yeah. And remember, by the way, the president said this is something that's actually going to save taxpayers money. It sure doesn't look like that right now.
Well, and when it does implode, the Republicans have to be ready to pick it up with a different plan, level the playing field across state lines, high-risk pools, and then basically the other thing, and conservatives don't like to talk about this, but I would say expand Medicaid, and even Medicare perhaps to include younger and chronically ill people. And then you cover everybody.
I'm with you on that, except for the Medicaid thing. I think Medicaid we've got to start over with Medicaid. It is, people on Medicaid are getting worse health care services than a lot of people in third world countries. But otherwise, I'm with you. I think we've got a meeting of the minds here.
I probably misspoke. I meant Medicare. Expand that down for chronically ill, younger people, and then you're set.
Yep. I'm with you.
All right, Stephen, thank you, sir. We appreciate it as always.
Anytime.
Stephen Moore from the Heritage Foundation on our turnkey.pro answer line.